Good afternoon, everyone. Myself, Dr. Kirti, Assistant Professor, Physiotherapy Department. So today we'll discuss about the different abnormal gaits. So first we are having the antalgic gait, which is a compensatory gait pattern adopted in order to remove or diminish the discomfort caused by pain or lower limb or pelvis. The characteristics include decreased duration of stance phase of affected leg, lack of weight shift laterally, decrease in stance phase in affected side will result in decrease in swing phase. Next we are having the gluteus maximus gait. There is a backward lurch of the tongue, hip extensor weakness, thorax being thrust back at the heel strike. Normally ground reaction forces passes anterior to hip joint early in stance phase, leading to external movement of flexion, which is opposed by the gluteus maximus. If muscle is weak, then the compensation is usually done by leaning the trunk backward, which leads to or brings the external movement posterior to hip, and shift the center of gravity posteriorly over the gluteus maximus, moving line of force posterior to hip joint. So with foot in contact with the floor, muscle require less strength to maintain hip and extension during stance phase. So the shifting is also known as rocking horse gait, as shown in the figure, because of extreme backward forward movement of the trunk. So next we are having the scissoring gait. It results due to spasticity of bilateral adductor muscle of hip. So one leg crosses directly over the other, which each step crossing blade of scissor, like in case of cerebral palsy. Next we are having the hemiplegic gait with spastic pattern of hemiplegic leg. Hip is into extension, adduction, and medial rotation, knee in extension, ankle with foot drop, with ankle plantar flexion inversion during both it stance or swing phases. And in order to clear the foot, the ground, hip and knee should flex, but spastic muscles won't allow hip and knee to flex for the full floor clearance. So patient hike the hip, bring the affected leg, making a half circle known as circumducting the leg. So gait is known as circumductory gait. Will be no reciprocal arm swing, so step length tends to be lengthened on the involved and shortened on the uninvolved side. Last we are having the Parkinsonian gait. In this, as shown in the figure, neck, trunk, knees are flexed. The shuffling gait or frozen gait, short rapid steps, arm stiff, abnormal associated movement. Fascinating, we can say lean forward, walk progressively, faster though unable to stop. There is decreased speed and stride length, and there is decreased range of motion at all the joints. So as shown in the figure, there is typical appearance of Parkinson's disease: stooped posture, masked facial experience, rigidity, forward tilt of trunk, and reduced arm swing, shuffling or short stoppage gait, and trembling of the extremities. Thank you.